have children between 1 to 5 years and have not sought any medication for either flu or cough, consider yourself lucky. Many parents and guardians are struggling to treat the rampant flu and cough among children. A visit to Kiswa Health Center 3 in Kampala showed that 118 cases of flu and cough were registered in December 2021, 64 cases in January, and 140 in February 2022.
This particular month of Feb, we have started again seeing rise because we are having prolonged dry spell.
True, actually we are seeing a number of children with the symptoms of flu and cough, and many of them, they tend to come with some fever also.
Parents and guardians confess that they have tried different treatment, but no improvement.
So given her more than enough medicine. Myself, I've gotten doses 4 times. Is it azithromycin, erythromycin, ampiclox, and all those? Ampicillin, Ceftriaxone, Coughlink, Tazekam, and so many. We've used many.
Doctors have advised parents to give plenty of fluids.
Let them take much of those warm fluids which are not from the fridge. And at the same time, the orange juices, yes, they can provide a lot of vitamin C. Vitamin C can protect the mucous membranes, and I think that is a good thing to do at home.
However, avoid giving children fluids which contain a lot of acid, as this may erode the lining of the stomach.
And we actually have seen many cases of peptic ulcers now in even children, like around 7 years. Those will go in. Sometimes probably they could be taking a lot of those acidic fluids, but you can always try to make sure it's not too much.
Doctors have however cautioned parents and guardians against administering unprescribed medication to children. Adiana Kuti, UBC.